We've all had to experience a hospital visit at one point or another in our lives, and during that process, you may not have realized that there is a group of people dedicated to advocating for your safety, quality of care, and cost-effective outcomes for you and your family's health needs. That team is the Case Management Department. Wealthy Jenner has the story.
So I think if anything that people need to know is that there is a system in place to help patients and families navigate the healthcare system, and that's what case management does. Whether it's educating them on the levels of care, providing them resources to care for themselves or their families afterwards, to help them navigating a system that can be very complex and overwhelming when you're already in a stressful situation.
Rasmussen says case management is the link from the doctor to the patient and vice versa.
When doctors they know that the patient is in need of something, but they're not exactly sure where to find it or where to direct them, they rely on the case management staff to help facilitate and answer those questions, as well as all members of that treatment team.
Each role of the team plays a vital piece of the discharge planning process, from the social emotional aspect all the way to the practical, helping the patient move on to that continuum of care. The team consists of a social worker, a RN, case manager, and a discharge navigator.
As a discharge navigator supervisor, my team is responsible for arranging for services for patients to leave the hospital. So they're the ones who send out for skilled nursing placement, home health referrals, getting them durable medical equipment. They do help in the beginning part of the discharge as well, with helping with initial assessments and things like that.
With the social worker addressing the patient's social aspects or barriers, the RN is ensuring that clinically the patient will move on to the appropriate level of care, and then the discharge navigator brings it all together. But overall, the team is in place as a resource for every type of patient.
We will help everybody. I mean, we're a community hospital, and we try and do our best, and we help everybody. Right. And for people who have the most amazing insurance, to the person who doesn't have any insurance. So that's as a whole, case management. That's what we are.
And many take great notice and appreciation.
So we've had family members come back and reach out to our to us as leadership and be like, so grateful for your social worker, or we're so grateful for your RN for all the hard work that they did for us. So that kind of stuff makes you feel really good about it. So yeah,
I think that's important for patients and families to know, that they don't have to do this by themselves, and that there's a team in place, a whole department in place that is there to ensure that for them.